Greetings, this is the coronavirus COVID-19 update for 3/20/2020, the Chinese virus. So this is Baidu, a Chinese search engine, and they set up a page to track coronavirus stuff, information. On the lower left, cumulative diagnosis, 81,416, that's up 116 from yesterday. Now, Baidu made a change here a couple days ago where they now include Taiwan and Hong Kong, and that's why that number 116 is a little bigger than what we're used to. And also they broke out Macau, which is the area west of Hong Kong that's China's Las Vegas, and it's a special economic zone, but so is Shenzhen, a city in Guangdong province. I worked there. It's, both Macau and Shenzhen should have been included in the numbers before, but Hong Kong and Taiwan have been added, and that's why you see that big number there. Now they have a new stat on the upper right, overseas input. So they're saying 41 new cases from overseas. And then cumulative deaths, 3261. So China now, who's basically fought this virus and got it under control, is now looking at overseas impact. And if you scroll down further on the same page, you see a map of China, and if you compare that with a map from a couple weeks ago, most of these provinces are turning lighter colored or white, and that's because they're using the same legend on the lower left that they did before, but now they're taking current confirmed cases and they're excluding deaths and what they call cures, which is actually recoveries. So this is basically a net now, a net number of cases. Then if you scroll down further, you see a new map or a graph, I'm sorry. There were 3 graphs. I'm showing you the old number 1 graph upper right because it's gone now. So it wasn't that useful. I don't know if they're going to put it back in or not, but this replaced the old number 1 graph, and it shows added for an input and total new diagnosis. So 116 new cases and 41 foreign input cases. And this is, if you scroll down further, you'll see this graph. This is what I call graph number 2, which is it plots Hubei province against the national and non-Hubei. So both of those, or all 3 of those, are pretty low right now. So 116 new cases, 0 in Hubei for a few days in a row now. So this is graph number 3, what I call graph number 3, which they added maybe, a week ago. Foreign new cases, 24,121 new cases outside of China, 116 new cases in China. And like I said, the majority of that is from Hong Kong and Taiwan. Mainland China has pretty much got coronavirus under control. And this is a global map, which is never close to being accurate, and we have something better. Then if you scroll down further, you see a list of provinces. I'm showing you the 2 smaller list of provinces from yesterday because today's figures are not out for some reason. But you can see on the upper left one, like Hong Kong and Taiwan, 23 in Taiwan, 25 in Hong Kong. So that, and there's some other provinces that add up to that 114, where most of that 114 is not coming from mainland China now. And if you scroll down further, you see the search topics. So like I said, Baidu is a search engine, and these are stories that people in China look for. They're looking for stories, and they use these search terms. So there's not always a real good relationship between what you see here, which is the search terms, and the actual story. Sometimes you can't tell what the story is by looking at the search terms. So the number 1 story every day is the dynamics, the numbers we just looked at. Everybody in China wants to see what the new numbers are. And we'll go over the rest of these stories that are interesting. So the first story, this guy on the left, he's not really a medical guy. I think China's trying to promote him now as like China's Stephen Hawking, so he's making the news a lot lately. Whatever he says, the communist government picks up his quotes. And this is a crazy thing. He bought a ticket and went to Wuhan, and the date on this ticket is 1/18/2020. So he's lucky to be alive. I mean, he actually took a train and went to Wuhan, right in the, high point of the epidemic. So that was kind of crazy, but this story came out today. On the right, 42,000 aid workers in Hubei have zero infection, and that's good news. I think these might be the buses of people that left yesterday. They tested them before they went on. And next story, usher in the spring. This is Wuhan. You see people outside exercising. They're not wearing masks anymore because Wuhan has had zero cases. Wuhan is the epicenter where all this happened, where there are thousands of deaths, and now they're cured. Wuhan is, you're allowed to go outside, but there's still people confined at home who are positive for coronavirus, but they're isolated. Then on the upper right, Australian woman who refused to be separated from Beijing. She refused to leave Beijing. She basically got ordered to leave, but they gave her a little bit of time. And the bottom right story by the same guy. This is a news story, just TV news, probably CCTV. And this is a car where somebody was found driving it who falsified that they lived in Wuhan and they're driving around in Beijing. So probably it sucks to be that guy. And then we have a story out of Italy where this Italian mayor is basically yelling at people for being outside. So he's yelling at runners. This is mayors are locking down some cities. Italy is in really, really terrible shape, as we'll see in a little bit. So this is a mayor that just came out to speak out against people who still go outside. And on the right, this is a story where, somebody decided that, students who were shut down from going to school because of coronavirus, he's against them getting extra points added to their exam because they missed so much school. Then we go to the Johns Hopkins Global Tracker. So the screens that you saw before were from Baidu, that's China. And now this has become the de facto global tracker for everybody, basically. This is a research institute at Johns Hopkins University called the Center for System Science and Engineering. And this has been evolving for a long time. It's a really good tracker. On the left, you have the total number of confirmed cases, and then you have it broken down by country. On the right, total number of deaths and total number of recovered. And on the bottom right, you have this crazy graph that's just crazy and unusable. I don't know why they're using it. They changed the scale today on the left. Now it goes up to 300K, which is good. But, still they have, I don't know what you use this for. Other locations, you might be able to use the yellow line to see what's happening, outside of mainland China. But the graph is just crazy because the green should be the total of the other two. Mainland China, other locations, orange, yellow, green. The green line should be above the other two. There's no such thing as a negative case or a negative death. So it's a little crazy, but the rest of this is really a really good tracker. Now, I had in the past up till now, I might quit doing this, I compare the Baidu numbers for all of China with the Johns Hopkins number for all of China. Because in the past, sometimes it was off by several hundred just because of reporting time differences. Now it's off because the Baidu number includes Hong Kong and Taiwan. So it's never going to be equal to the Johns Hopkins number anymore because Johns Hopkins breaks out, Taiwan and Hong Kong. They're just further down this list. So I'm probably not going to compare this anymore. Then the first thing I want to talk about is Korea. I used to, focus this first part outside of China on the epicenters outside of China, which was Italy, Iran, and South Korea. Now there's all kinds of other countries moving way up the list. and South Korea is dropping every day. But still, I want to talk about South Korea first because they are the model country. They're treating this issue better than any country in the world. They followed a lot of Chinese examples and what to do, but they didn't make the mistakes that China made. So if you take a look at this is a graph that I made. The South Korea is in orange. So if you look back on 2/22, February 22nd, from that, for the next few days, South Korea was just taken off. The number of new cases over, 2,000, 4,000, 6,000, they're way above other countries and going strong. And that's because of this, church issue that they had there. This epicenter is in South Korea. Comes from a little city called Daegu. It's not that little. It's the fourth largest city in South Korea, but that's where this church epicenter started developing. So this is I'm going to make another video just on South Korea, but really quickly, if you look at the upper left hand side, China and South Korea models seem to be the only way to contain COVID-19. South Korea basically copied everything that China did right and none of the things they did wrong, which China did mess up quite a few times. And South Korea wants to show the world how to tackle coronavirus. One is they made their own test kits. How did they make their own test kits? Because they're smart. The WHO passed out these papers with just information on what differentiates the new coronavirus from old coronaviruses. So old coronaviruses are things like SARS and MERS. They're both coronaviruses. And the way you test to see if somebody is positive for the new one is you test for these genetic markers that are absent in the old types. So that's what the WHO passed out. As soon as they passed it out, South Korea got busy on it and they started making test kits. They developed their own test kits in 3 weeks. So they were ready when this big issue happened in South Korea. South Korea was already ready. So they went crazy testing people. And on the right, you can see the car drive-by testing. They invented that. As you drive by, show your driver's license number. We'll show your driver's license. We'll scan it, and then we'll take a swab from your mouth, and you're tested. And then they started isolating people in Daegu, and you can see the middle thing here. They have a little quarantine kit where they would give these people food and stuff that they need. You can see in there food, water, masks. There's toothbrushes in this box. That's what they gave to everybody who was in quarantine every day. So, and then on the bottom right, Korea's new virus cases continue to slow. The infections top 8,000, but they basically topped out at 8,000. And finally, the other thing they did was they identified the drug that they wanted to use. And this is what's really wacky about this is, this is lopinavir and ritonavir, two drugs made by Abbott Laboratories, an American pharmaceutical firm. And then Abbott Laboratories spun off this new company, AbbVie, and AbbVie makes this drug Kaletra, and Kaletra contains lopinavir and ritonavir. These two drugs are a malaria drug and an AIDS drug used together in a new pill called Kaletra. That's what South Korea used to treat everybody. It worked. It's not approved by the FDA yet, but they have a boatload of this stuff, and that's how they cured everybody in South Korea. So they are a model for the rest of the world. So next, we'll take a look at these new epicenters in the world: Italy, Spain, Germany, Iran, US, and France, who are way above South Korea now. South Korea is only going to have, 100 or less cases every day because they have it under control. Other countries are way out of control. So Italy yesterday set a new record for the number of deaths, and they also, had some very sad news. We'll look at that next. But, today they had even more deaths. Today they set a new record, went from 3,400 deaths yesterday to 4,000 today. So that's over 600 new deaths. So this is Italy. On the upper left, you see that story from yesterday. It was really, one person called that this is the most sad picture in the history of my country. And if you take a look there's a line of trucks, there's a bigger picture on the bottom left. And these are Italian military trucks that are in a city in northern Italy, and they're stopping by to get loaded up full of dead people in body bags to take them out of the city and burn them. So that's what these trucks are doing. Because there's no room in the cemeteries in this town to bury people, and because there's way too many people to even think about it. So all the people that that have died, they're not going to have funerals, they're not going to have anything. They're put in a body bag, put in trucks, taken out of the city. There's so many dead people. That's what you had to do. And on the lower left, there was a video that went viral a couple days ago from Italians trying to plead with people from the rest of the world to take this seriously. So, La Repubblica, we have a story today, 4,670 positive, 627 deaths. That is, way beyond the Chinese records, which were in the low 400s for the number of deaths in a day. And still we have people, outside in Italy. And, it's they're playing with putting actually the whole country of Italy is on a quarantine, not a quarantine, under a lockdown. But only some cities are actually quarantined. And one is where these trucks showed up. But other, the big stories out of the Italian press today were, there's still a lot of people going outside every day. The sooner we stay home, the sooner we put this terrifying period, the sooner we get out of this period, the sooner we put it behind us. And on the right, closed parks and sporting events, there's still people out bicycling around. And on the upper right, they put a timeline together and identified, this all started in Italy with one Chinese couple that, were on holiday from Wuhan during the Chinese New Year, and they visited northern Italy. And that's how it turned into an epicenter. Then we go to Spain. Spain, upper left, a story from yesterday, 80% of all people in Madrid will get COVID-19, official says. And, today the story is zero tolerance, what Spain is doing. They've got extra police now running around the city, making sure nobody's outside, basically. Lower right, Spain to close all hotels, help nursing homes as coronavirus deaths climb. So a lot of things are shut down in Spain now, and there are police patrolling around to keep people off the streets. Still a big jump in deaths for Spain today. So this is, I've been putting Germany and France on one page, and I continue to do that because before about a week ago, if you went into any news publication from either country, all you saw was news about the rest of the world. Even though they were sneaking up this list, now you have China, Italy, Iran, Spain, Germany. Germany and Spain are really moving up the list, but you don't see much news out of Germany about Germany. So only the last couple of days have you started to see that. So I take a look at the Welt and Spiegel every day, and I spend a lot of time in Germany. I can speak German, so the news out of the world today is federal states are now drastically restricting public life. That would be provinces inside of Germany, and a threat that German national curfew. So they might impose a national curfew all over Germany. And on the right, out of the Spiegel, which is German for mirror, you can see a policeman patrolling around and asking people, why they're out walking around. And in France, Connection in France 24, So France 24, containment is absolutely a key in the struggle against COVID-19. From the connection, this is a English-speaking French site. You don't have to translate it. France arrests people for being outside, basically. And then news from yesterday, this French lab offers millions of doses of COVID-19 drug. So they've been talking a lot about this new drug coming out of France, but it's exactly the same thing as the American drug. It's a malaria drug and a HIV drug combined, and that's what South Korea used. And now France has developed the same thing. And then next is Iran. You can't believe any information coming out of Iran. For the last few weeks, they've been saying every day that it's U.S. sanctions are keeping them from fighting the coronavirus. That's why it's growing so rapidly in numbers. I mean, if you take a look at the numbers here, there are 19,644 cases. It's probably 10 times that many. And the number of deaths on the right, 1,433 deaths. There's like the article from the Washington Post on the upper left, coronavirus burial pits so vast they're visible from space in Iran. So, for a couple of weeks they were saying that it's the U.S. sanctions that's keeping them from fighting this, which is totally crazy. You have sanctions because you sent a general into Iraq to get together with a bunch of terrorists and kill people at the U.S. embassy. So the U.S. killed the general. And then the next day you shot down a commercial airliner. That's why you have sanctions, okay? The reason you have a coronavirus problem is this pilgrimage to Qom, the city. You can see the pictures on the bottom left, where the leadership in Iran was saying, we're not going to tell you people to not go to this. Come to this pilgrimage, But the problem is it's such a confined area. There are all these people that are visiting here from other countries are, staying in the same hostels. They're packed in the actual shrine itself like sardines. And there's, these idiots are licking the sides of the walls here just to prove they're not afraid of coronavirus. So now, that's why you have a coronavirus problem. It has nothing to do with U.S. sanctions. Then we'll talk about the U.S. of A., which 13,678 cases yesterday to 19,285 today. So the big epicenters in the United States, Washington, the state of Washington, mostly a 3-county area south of Seattle. And California, mostly San Francisco and LA, and then New York, which went from 5,700 yesterday to 8,400 today. And as you can see, the total deaths in the United States, 250 now, and total recovered 147. So we'll take a look at these epicenters. New Jersey is also growing a lot, so they're getting close to, being an epicenter themselves. So Washington, the big news out of Washington this week was on Monday. If you look at the screen prints on the lower left, a clinical trial of a vaccine started on Monday with, I think it was 45 different volunteers. So that's ongoing now. It could take 6 weeks. It could be accelerated, but there's a vaccine, and that's really good news. And current news today, death toll hits 83 in Washington as officials focus on social distancing. Most of the deaths in the state of Washington came from a retirement home in Kirkland, and that was in Snohomish County, south of Seattle. The three counties south of Seattle are in really, that's really the epicenter in Washington. More news today, Metro bus riders to be free, riders to enter the rear doors. Of course, if you're going to open up your buses to be free, it's a good idea to have people get in the rear doors of a bus or the side doors instead of the front where they come in real close contact with the bus driver. And, that's the new news out of Washington today. And in California, the news yesterday out of California was a governor came out and said, this is a stay at home, go home and stay home. So that was an order given out, by the governor. And then the news today, after death of a 34-year-old Southern Cal man, a dire warning for young people about coronavirus. And I watched this video. This guy's 34 years old, pretty healthy guy, and he died. He actually died a couple days after being diagnosed. And there's a map here of California that was published that shows the epicenters in California, every county and the number of cases they have. And you can see LA down at 292, and then the other big area is the San Francisco Bay Area, San Francisco, and there's a few counties around there that are getting up over 100 now. And on the right, you see LA County gives up on containing COVID-19, tells doctors to skip testing. That's a little sensationalized by some idiot. The real article said that, they said, don't bother, ordering a test for somebody unless the results of that test are going to determine how differently the patient is treated. So, if you have a patient at home that's in pretty good condition and you want them tested because they're in self-isolation and it wouldn't change their situation, don't request a test because they're overwhelmed now by tests. This is the county. This is actually the biggest healthcare county organization in the United States. Not much news out of New York City today. A big increase in the number of cases. The mayor came out and declared that New York City is now the epicenter of the crisis. As far as the United States, that's certainly true. Bigger numbers than anywhere else. More than 11,000 people worldwide have died from the coronavirus. And, the governor just came out, and I listened to half of this today. So there's no real news on, where all the deaths are taking place. But like I said before, it looks like New Jersey is becoming another epicenter just because of its proximity to New York. And then this is a graph I put together just to show the United States, and because nobody else is doing it. If I find another one, I'll quit doing this. But this is the U.S. numbers. As you can see, it's kind of accelerating. The number of new cases is curving upward, which is something we don't want to see. Went from 14,250 to 19,352. And this is how some selected countries look. Another graph I created. You can see the South Korea in orange is basically, went up to 8,000 and just stayed there. Where other countries, everybody's passing South Korea now. So all these, you have Italy, France, Iran, Spain, Germany, and the USA. The USA right now is accelerating more than anyone else. You can see that right the last couple days in the dark blue, really, really steep graph for the United States. And that's all we have today. Thank you. Appreciate your time.